Hi, today I'm going to be talking about the much discussed and debated topic of how to care for a boy's foreskin. My name is Professor Paddy Dewan. I'm a paediatric urologist, so I look after the plumbing of children. So there's a lot of debate, as I mentioned, about the care of the foreskin. A boy's foreskin is formed out of the same piece of tissue as their penis, and initially in most, it's actually stuck like a banana peel to the head of the penis. Over time, that peels apart. One of the things that isn't well understood is that the narrowness of the end of the foreskin is more important to consider than the adherence of the foreskin to the head of the penis. Some instruct families, don't touch, leave it alone, you'll hurt it, you'll peel the banana. But, like a boy's bottom, you need to clean it thoroughly, gently, and therefore unrolling the foreskin gently to wash it is what you should do. As a result of the don't touch approach, about once a month I have to do a circumcision for a boy who's been in severe pain with what's called balanitis. That's an infection at the end of the foreskin, and it can become so bad that they get what's called BXO, read really nasty soreness at the end of their penis, where they can even get blockage of the flow of the urine out of their penis. So the point in the main for the care of a boy's penis with a foreskin is to unroll it from the first day of life, gently each time the nappy is changed, so that you can wash it and when they're in the bath. And very importantly, as they become more independent, you teach them to clean their teeth, which you need to nag them about. You need to teach them and nag them about wiping their bottom. And remind them, did you roll your foreskin back when you went to the toilet to do a wee? Now you're in the shower, you roll your foreskin back so you can wash it. The adherence of the foreskin to the head of the penis can produce the appearance of some yellow bubbles called smegma. That's a normal separation of the skin from the head of the penis process. That's not pus coming out, it's actually the smegma escaping as the skin separates. If a boy who is 8 or 9 or 10 still has a partially stuck inner layer of the foreskin to the head of the penis, then that can be normal. So when do you need to seek assistance with your boy with his foreskin? Clearly, if there's an infection, you should seek to have antibiotics and to be reviewed perhaps by a specialist, but GPs should be able to handle most of those situations. If the foreskin rolls back, and when you roll it back it has a dome shape to it, and it has a little pinhole, that is something that will hopefully get better with the application of steroid ointment, but is more likely to require an operation. If the foreskin, when you roll it back, has a very long funnel and then pouts out, maybe it's designed never to be able to come back, and that needs to be considered by a specialist. If your child's foreskin doesn't come back over the head of the penis, that is not necessarily a problem, and the way that you tell that it's probably not a problem is it's like a rosebud opening near the head of the penis. If it does that as a little baby, it doesn't need to come all the way back, but at least you get to clean more of the foreskin. So if there's infection, you should seek assistance from a doctor. If you try to unroll it and it looks like it goes into a dome shape with a little hole, you should go and seek not only a GP's assistance with perhaps steroid ointment, but the care from a paediatric urologist like myself.